Hello and welcome to Alive with Amanda. Our question for the day is, do I need to diagnose clients if they are private pay? And do I need to keep notes and treatment plans and discharge plans? So I'm going to give you the sort of like ethical answer, or maybe the answer if you took a course that they would give you. And the answer is yes. Even for my private pay clients, I do the same exact process. I have them sign all of the paperwork. I do an intake, right? I have them sign informed consent, our policies, payment, all of that information. I do an intake. I do a full intake. I take lots of notes. I keep detailed notes. We use TherapyNotes for our electronic health record. So I fill out everything that needs to be filled out in TherapyNotes. I absolutely include a diagnosis. I do diagnose people if there's a diagnosis and if it's appropriate. If there's no diagnosis, I'll write no diagnosis. If it's an adjustment disorder, I'll diagnose with adjustment disorder. If it's something different, I will, whatever that diagnosis is. I don't not diagnose people just because they're private pay. Now, if somebody came to me and said, listen, I want to be private pay because I don't want a diagnosis, I would put I'd have to really consult with somebody. Like I'd probably consult with like our ethics person, or I'd kind of really look at that, but I would be more inclined to put no diagnosis or like not diagnosed on a private pay. But at the same time, I always think about like the flip side of it is that if my notes, my treatment plans, and were ever subpoenaed and I have to answer for that, like if somebody was seeing me for a year and let's just say they had something more than adjustment disorder, like they had post-traumatic stress disorder. And I was documenting that they were having flashbacks, that they were having nightmares, that we were doing EMDR, right? And then I put no diagnosis. And then for whatever reason, I had to go before a judge and defend that. I think I'd have a really difficult time doing that. I don't know that the answer would be, hey, like I just decided to not diagnose because they paid me cash. Like that doesn't feel right. That doesn't feel good. And so my process, and I have never had anybody come to me and say like, hey, I'm coming to you paying cash so you don't diagnose me, right? I'm always known as like the anxiety expert. So actually when people came to me and paid privately, it's because they wanted to get that level of care and that level of support. And they knew that they had some form of an anxiety disorder. And so I always diagnose them. And so I think you have to be really careful, even when you're private pay, that you do intake notes, you do a treatment plan, you do reviews, you do your notes. You can decide, what those notes look like. Again, we use TherapyNotes, so we follow their process. We follow their plan for treatment plans. For us, two things we know for sure because we've had both of these things happen. One, they pass audits for insurances. Fantastic. Love that. Two, they pass subpoenas. Our notes get subpoenaed all the time because we do a lot of court-ordered work, and they pass. And we haven't, knock on wood, I'm a little superstitious, knock on wood, they've passed. And so we know that the level of quality that we provide is really fantastic. And that doesn't just include the therapy that we're giving, but also the documentation. It's the same like if I went to a doctor, I would expect if I had a diagnosis that even if I was paying cash, that there would be a diagnosis there because maybe I need that for some reason, or maybe eventually I'm going to go on disability and I need all of that paperwork, right? And you don't know that. People don't know that. Like things happen all the time in people's lives. So the way that I teach my group practice is that we diagnose appropriately regardless of payment. I'm going to talk about one more reason why you might want to think about your process, even if you're private pay. But first, I want to thank our sponsor, TherapyNotes. If you're looking for an electronic health record that's really full service, one that you can write your notes, your treatment plans, your discharge plans, your intake notes, like fantastic, that will pass an insurance audit. So if you're ever considering taking insurance and you're nervous, I would check out a platform like TherapyNotes because it makes it so easy to be compliant. And a lot of the times, if you're compliant with insurance, you're compliant with courts, you're compliant with life or disability insurance and all of these other areas. And it really makes it easy. So I highly recommend you check out TherapyNotes. So again, I don't want to like throw out the ethics and be like, you're wrong, you're bad if you don't write notes. But I think you always have to cover your, what. I was taught that from the very beginning. My very first supervisor, like bless her heart, taught me that CYA, cover your you know what. And that always stuck with me. And I always took documentation really seriously. It's probably why I was a good clinical director. It's probably why I consider myself to be a good group practice owner, right? Because I take documentation seriously. I understand that the therapeutic relationship isn't just the talk therapy that I provide or the techniques that I provide, but it goes beyond that to quality documentation. So it's not to shame anybody if you're not a documentation person. Listen, I know a lot of fantastic therapists that don't like documentation. If it was up to them, they would never do any documentation. So you don't have to love documentation. But I think you need to do right by your clients and you need to do what's ethical. And so always check with your boards, always check with your liability insurance if you ever have a question. But yes, I think you need to write notes and do treatment plans and diagnose and do your due diligence, do the things that you were taught. And again, if you come from a systemic approach and maybe you don't diagnose or you were taught differently, that is okay too. Just want to make sure that you are also covering yourself, that if any time one day somebody subpoenaed your notes, that you wouldn't have to get up and defend that. So I hope this was helpful. I'll see you soon, everybody. Bye.